Each year, over 10,000 nurses graduate from nursing colleges in Thailand. Often called the White Angels by families and friends, these young graduates join the public hospital system with hopes and dreams. Thousands of Thai nurses organized a protest rally outside Government House in Bangkok. The rally was called by the network of registered nurses employed on short-term contracts, demanding that the government and the Ministry of Public Health end discrimination against nurses and call for decent work and job security. At that time, there were more than 17,000 registered nurses employed on short-term contracts across Thailand. The nurses who were rallying at Government House were determined in their fight for decent work and were prepared to call for strikes and to leave their jobs at Thai public hospitals had the government failed to respond to their demands. Following the nurses' protest actions, the Thai government engaged in dialogue with them in October 2012. An agreement was reached to convert the short-term contracts of nurses into permanent positions. Panida is a dental nurse.
จังหวัดเนาะทำเรื่องเงินเยียวยาให้เราก็คือหมายถึงว่าทำ
For the past 4 years, I've been following up on back pay, which I should receive from the government as compensation for my lost benefits when I was employed on a temporary contract in 2016. Another issue is the different rates of overtime payment. What I am getting is 480 baht, while a dental nurse working at a sub-district hospital gets 600 baht.
Dusani, a 39-year-old, is employed as temporary contract staff with a job title of patient assistant.
I do many different jobs at the hospital, including cleaning hospital equipment and getting them ready for medical staff to use. I have been working for 13 years at the hospital. My employment contract is not a permanent contract, and the only benefit I am getting is Social Security. There should be more benefits. In the past, permanent contracts were used for patient assistance, but now only temporary contracts are used. Apart from the minimum salary, I get overtime payment of 300 baht, which should be increased to 350 or more, as it has not been increased for the past 10 years. It would be better if we could be converted to permanent staff. When some permanent staff retire, we should be considered to fill in those permanent positions. What is happening now is that more and more people are employed on temporary contracts for a long period, without the possibility of becoming permanent staff.
Chalerm Kwan is also a nurse aide.
I am working at the hospital as a patient assistant. When I started this job 7 years ago, my salary was 4,020 baht. Now I am earning a salary of 8,090 baht. I also get paid 300 baht per shift for overtime work. Including OT, I earn around 12,000 baht per month.
Satsita works as a scrub nurse in a hospital operating room.
I am a scrub nurse, and my worry is the fact that I have to inhale smoke that comes out of the cauterization equipment. We use this equipment when we have to cut tissue and to stop bleeding during operations. I have read from a journal that this kind of smoke is detrimental to health and can cause cancer.
Hospital cleaners also have grievances. Cleaners lose wages for the days they are ill, cannot come to work, or have work-related accidents. Even cleaners with long years of employment at Thai public hospitals are told by management that they are employed as daily workers and have no rights.
Malika Lunajak, president of the Nursing Union of Thailand, or NUOT, led a delegation to meet with the Parliament's Extraordinary Commission on the draft amendment of the Compensation Fund Act on the 8th of May, 2018. Nuat gave testimonies on the actual cases of nurses and other workers who became victims of occupational health and safety. At the time, civil servants and other types of employees working at state hospitals, public schools, state universities, government ministries, and other state agencies were excluded from the Compensation Fund Act, and their grievances were not taken seriously by their respective government agencies. Nuat also alerted the commissions about the tragic suicide of Kanapan Panthergun, who had been employed in the laundry department as a temporary worker at a public hospital for 17 years, earning low wages.
Dear Prime Minister, the Public Health Minister, management of all hospitals, and the relevant persons who can help. My name is Kanapan Panthergun. I am giving up my life with hope that you will consider us temporary workers who have worked for a long period. I beg for your help to find solutions to regularize temporary workers so that they can have better lives. Many have worked for 5, 10, 15, 20 years or longer. The work we do, in my view, should not be called temporary work. These are the jobs that must be done every day, every month, every year. My life is not of great value and I can sacrifice. I do hope you consider us temporary workers who do not earn enough to feed our families. We all have to buy food just like you. I also hope my life would not be wasted. All temporary workers should have better lives. Please remember that the work we do is regular work, not temporary.
The commissioners admitted that they were shocked by the reports on the situation of nurses and workers employed at state hospitals and promised to take into consideration the input provided by Nuat in the process of reviewing the draft amendment to the Compensation Fund Act. That meeting resulted in an improvement for contract workers employed by public hospitals and other government agencies. They are now protected by the amended Compensation Fund Act. Civil servant nurses who daily face occupational health and safety risks are still excluded from the Act. Jirataya, registered nurse, was in that ambulance. She was trying to save the life of a patient who had been taken to the hospital for a head injury. It was the 1st of January 2018 when Jirataya was assigned during her night shift to accompany the patient in an ambulance while he was being transferred to a bigger hospital, not knowing that it would be the last time she ever walked.
The moment I learned I would not be able to walk again, it felt like I had fallen into an abyss and I had to try to climb up. Physically, I have become permanently incapacitated. I was also worried that I might lose my job. Now what is worrying me the most is health complications. As I cannot walk, diabetes, blood pressure, and kidney disease are likely to come.
In May 2020, it was reported that more than 7,000 health workers worldwide had lost their lives caring for COVID-19 patients. Out of this, more than 600 were nurses. In Thailand alone, nurses account for nearly 50% of the healthcare workers who were infected with COVID-19 while working. On the 5th of April 2020, Manisara, registered nurse of Chiang Rai Pratanukroh Hospital, lost her life after fainting. It was reported that she had worked very hard to care for patients without adequate rest. She was also diagnosed to have lung infection and heart disease. At Lamphun Hospital in northern Thailand, Chaiwat, who worked in the X-ray department, had earlier been diagnosed to have high blood pressure. After working long hours to service patients at risk of contracting COVID-19, he was found after having fainted. He was rushed to the hospital's emergency room, but his life could not be saved.